Now, you might have noticed the word COVID creeping into conversation more and more. Well, cases are on the rise. The number of people with the virus actually jumped nearly a third in just the last week. Well, here to discuss this, hopefully to answer the questions as to whether we should be worried about this, is virologist Dr Sarah Pitt. And good evening to you, Dr Pitt. And I have to say, this is the highest cases have been since April. Should we be worried about that?
Well, we should certainly be taking it seriously and understand that COVID hasn't really gone away and the pandemic is not over. What seems to be happening is a combination of things. So first of all, we've got the Omicron variant of the virus has been slowly changing. And around about Christmas time, we had what we called BA1. So that was just the name that they give the variant. In spring, we had BA2, which that's when I had COVID myself, having thought that I would have been safe and kept myself and my family safe for 2 whole years. I managed to get it around Easter time. And then, as you say, a lot of people are starting to get it now. And this is a new version of the virus called BA4 and 5, and they seem to be taking over now from BA2. That's a bit more infectious and a little bit nastier. I'm sure people, your viewers who are have someone who's had COVID or experiencing themselves, probably realise that it's not that mild. It's not like a common cold, the sort of things that people were seeing around Christmas time with BA1. This is actually can be quite nasty, and you can be quite sick for a week or two, even if you're a very healthy adult who's had all your doses of the vaccine that have been offered to you. So what we have seen is people have not thinking that COVID's over. So people are not really wearing masks in enclosed public spaces. I'm often the only person in the shop or on the train that is wearing a mask, and people are looking at me funny because I'm the only one wearing a mask. And obviously, people aren't testing themselves regularly anymore. And we know that probably 1 in 3 people who have COVID and are infectious to other people don't really have any symptoms. So that's really helping to spread. And although people are socialising outdoors more, which is a good thing and should be safer, we are actually sort of crowding together a little bit more. A lot of big events are happening, and those are sort of places where people can spread COVID around. And so we're not necessarily wary of COVID in the way that we would have been maybe this time last year. So I think it's a combination of all those things.
Yeah, we were just looking at pictures of Glastonbury just last week, Dr Pitt, and just loads of people obviously gathered for that. And you said it's maybe nastier, but my whole household, Dan mentioned it before the break, my whole household got COVID. It was nasty, but it didn't last as long. Could that be because of the vaccination, of the vaccine? We've all been vaccinated.
Yes, the vaccine definitely helps to stop you from getting really very sick, but obviously it doesn't stop you getting sick at all. And what we're finding is that a lot of people haven't had their booster dose that they should have had. So some people haven't had their 3rd dose. And I think it's partly because if you've had COVID, you have to wait a month before you can actually have your next dose. And so a lot of people got COVID in December, January, February, and didn't have their booster, and then probably thought, well, COVID's over now, so it doesn't really matter if I don't get my booster. And also the bout of COVID that I have will give me some protection. My immune system will have been boosted. But what we've seen, there was a study that was published a couple of weeks ago from healthcare workers in London, which they followed them up all through the pandemic. And they found that if you got this Omicron BA1 or BA2, didn't really stop you from getting COVID again, Omicron 4 and 5. So although the vaccine is a good idea and definitely stops you from getting very ill, you can still be, quite sick, enough to be off work in a lot of cases.
And Dr. Pitt, you said you're still wearing a mask. I mean, do you think that's something people should be doing?
Yes, I do. And I'm doing it because I know that it's a helpful thing to try and stop the spread of the virus. Just in case, I actually have COVID and don't know it. I'm not testing myself as regularly as I used to do because we don't have the kits now. So, that's something to do. But it works much better if everybody's doing it, because you have to remember that I'm wearing a mask to protect you, you're wearing a mask to protect me. And the studies that they've done around the world that show that if the majority of people in a particular environment are wearing masks, they work much more effectively. Obviously, it doesn't stop you getting COVID altogether. I said I got COVID around Easter time. I was travelling on public transport. I was up in central London, so I was going on the London Underground and on trains and things, and I was wearing masks. Not everybody around me was, and so I'm sure that's where I picked COVID up. But it's better if everybody does it in enclosed spaces, such as public transport, going into shops. I know not everybody likes doing it, and there are some people that can't do it for medical reasons, and also sometimes it makes communication a little bit difficult. But still, it's a sensible thing to do, because really that's all we've got at the moment. We're not doing regular testing, and most people have had the 3 doses of the vaccine that they've been offered so far. Some of the over 75s who should have had their booster haven't had their booster yet. So if that's any of your viewers, I would recommend that they go and get their booster.
I'm afraid we have to leave it there, I'm afraid, Dr. Sarah Pitt. But thank you so much for talking to 5 News. Thank you.
Thank you.